I've actually seen it within the last, I would say, 10 years evolve quite a bit. So when we started out 10 to 15 years ago, there was really a long-held belief that if you had metastatic cancer, really at almost any site, that quote-unquote the horse was out of the barn and that local therapy was of no value. We then started to see in other tumor types debulking surgeries being helpful, or resection of the metastatic site offering significant improvement in survival, like in colorectal cancer and resection of liver metastasis. And so people started to consider the fact that perhaps this was the case in breast as well. And so the retrospective studies were then designed and performed, showing this significant overall survival benefit in multiple trials. And so really clinically, a lot of people jumped on board. I would say even I jumped on board, thinking that this was of great benefit to patients, and if they did well with their systemic therapy, that we could strongly consider them as candidates for surgery, and that they potentially had a large improvement of overall survival. When the prospective trials were designed, and then we started to see early results, almost every single prospective trial, and even the Turkish trial in their early reports, there was no difference in overall survival. So I think the pendulum swung quite quickly in the opposite direction, back to where people had been before all the retrospective trials had come out. And so right now, I think we're seeing that pendulum come back a little bit, where we're being very thoughtful about who we offer this to, and very thoughtful about giving them expectations that we just don't know. We don't know whether it's a benefit, but that if it's a low-risk surgery and they're otherwise a good candidate, that it may not be a bad idea.